June is Men's Health Month, and it's also National Cancer Survivor Month. So this focus of healthy living is going to be on those two topics, and I'm lucky to have with me today three wonderful guests. We're going to start our Healthy Living show today with Jay Morange. He is the Director of Outpatient Operations for St. Tammany Health System.
Yeah.
So Jay, thanks for joining us.
Yeah, thank you.
Yeah.
So I'm the Director of Outpatient Operations for St. Tammany.
Mm-hmm.
I've been with St. Tammany since 2008, right out of high school. I was a rehab tech, then went on to physical therapy school, and I was blessed enough to be able to get back on with the system after school, and from there grew into administrative roles. So my current role, I oversee our diagnostic clinics in Mandeville, the Mandeville Diagnostic Clinic, and then our Paul D. Cordes Outpatient Pavilion. So,
okay.
Yep.
Great, which incidentally, the Paul D. Cordes Outpatient Pavilion just won the City Business Best Diagnostic Imaging Services in the area. So we're very proud of that.
Yes, very
And congratulations on that achievement.
Thank you. It's certainly a team effort from the front to the back. It's a team effort. So
well, we're excited about that. So we have an event coming up. Men's Health Month, as I mentioned in the beginning, is the month of June, and we have an event coming up that was sort of your brainchild, and it's going to be a fun and different event that we haven't really done anything like before. It's called Man Up, Take Charge of Your Health.
Right.
So tell us a little bit about it. Like, what was the impetus for you wanting to give men this opportunity?
Well, honestly, is a little bit of envy. You know, we have no trouble or have, you know, talking about women's health, and you see that pink ribbon in October, you know what it means, and
right.
It's easy to understand, and I got a little jealous, like, hey, what about the guys, what about us, and honestly, more importantly, guys just, I think, don't keep that same focus on their health. I'm included on that. And
right.
I usually have to be made to go, hey, you got to take a doctor's appointment, take off of work, those kind of things. So that's where I was like, we need to do something for the guys. Let's have a men's health event.
Right.
And it's June. It's a perfect time of year to
Father's
do that.
Day month, right?
Yeah, Father's Day's that same weekend. So really, it was a great opportunity to put this together and give to our community.
So what's it going to be like? So first of all, let's say where it's at. It's at the Covington Beer Garden, guys. Come on. So tell us a little bit about what the day will look like for the guys.
So yes, it's at a great venue at the Covington Beer Garden,
mm-hmm.
Great layout there, nice outside venue. We're going to have some nice yard games there. We'll have some, mobile axe throwing, which will be fun. A little crazy, but we'll have fun. Enjoy some libations as well. But more importantly, we're going to have some education and screening by a great group of providers in a wide spectrum of different screenings and education. So, and that's the more important piece to it. And it's going to be in the evening from 5 to 8 p.m. So perfect time of day to get out and have some fun and get some free education and screening.
Right, and this is a Friday night, correct?
Correct.
Friday, June 16th.
Yes.
So let's talk about, and you don't necessarily have to do all of the screenings, right?
No.
You can come and you can just talk about certain things. If you're not comfortable with doing the screenings, that's fine. We encourage it, obviously. But we're going to have some education on prostate health. We're going to have some colorectal cancer education and screening, skin cancer screening, heart health education, carotid artery ultrasound and education, and then the musculoskeletal ultrasound screening and education. So all of these components are part of really everyone's health, men's health. The prostate obviously is directed to men's health, but all of these things are important for all of us to do.
Yes.
And sometimes it's fun to be reminded it's good to be reminded in a fun, kind of casual way,
right,
with like-minded or men of your same age or even different age groups. So we're going to have all the providers, like you said, providing these. Let's talk particularly about musculoskeletal ultrasound screening and education. What is that? Because that's your specialty. That's what you're going to be doing, correct?
Right. Not just me, but our team of therapists at St. Tammany Health System. And just to give a little background, musculoskeletal ultrasound is a diagnostic modality that we've been working and training towards for the past 4 years at St. Tammany Health System. And I'd be remiss to not give a shout out to our board and our administration for giving us the resources and tools to do this and bring to our community. And so, our physical therapists actually do the ultrasound itself, scan the patient, and given our education and background, we're a great fit to provide this service. And then from there, we'll give our report, and that goes back to your doctor, and it helps appropriate that care after an injury. So you say you have an injury to your shoulder, you go to see your primary doc, hey, my shoulder's hurting. This day and age, our insurance doesn't just say, hey, go get your MRI, no problem, we'll pay for that high-cost modality. Even though we suspect you probably have a significant tear and you need to have some form of intervention and advanced imaging modality. So musculoskeletal ultrasound offers a low-cost, effective image to help appropriate to say, yes, that is a tear, that's what we thought, or no, it's not. Hey, let's just try some conservative therapy. But in the meantime, say it is a tear, and you have to go through conservative care for the hurdles of insurances, that's 4 weeks you're trying to do therapy through a tear in your shoulder. That hurts. You have to resort to pain medication, which we don't want.
Right.
So with this imaging modality, we've gotten to where we scan a patient at our Paul D. Cortez Outpatient Pavilion, and they're in an MRI suite in 10 days, where before it's 4 weeks of conservative therapy, then back to your doctor, then you finally get into the MRI. So really it's helping, smooth those transitions of care and appropriate where that care needs to be.
And for me, as a patient, I'm saying, okay, that's more time that I get back in my life. And then you save money because you have fewer interventions by a medical professional with this one ultrasound.
Right, and you appropriate those interventions. Yes, this is justified. No, we need to just try this route first. It really helps kind of point that direction and get the patient where they need to be. So it's a fantastic modality. I've really been excited to get this program off the ground. It's taken a long time, but we've really worked hard, and you can currently get scanned at our outpatient pavilion with the doctor's order. Our therapists are also offering this in the emergency room at our hospital as well, to be able to help with those times of need of a real acute pain, but maybe you don't have a fracture, but you do have a tear. So it's really going to help with that as well. So exciting times, great service, and it's a great thing to offer to the public here in St. Tammany.
As the patient, what would I say to my doctor if they said, okay, well, let's go start with this? How would I ask them about this particular diagnostic tool?
Well, good thing is we've been educating our providers of this service line and helping them understand what tool it gives them to be able to help their patients and help their plan of cares and where they need to send their patients next, or interventions they need to do with their patients. So really on the forefront, us educating the providers to help them,
So they choose this?
Yes.
Gotcha.
Because they're in the same boat. It's, man, I know there's something significantly wrong with my patient, that they need intervention, but here I am, I'm stuck under what the insurance is telling me what to do. Instead of the physicians having the ability to kind of direct the best care. Correct. So we're just trying to help bridge that gap.
Okay. Well, we would also be remiss if we didn't mention that out of the 8 nationally certified MSK or MSUSK, you have to say it right, clinicians in the state, how many do we have at St. Tammany Health System?
So we have 4 of them.
We have half, so that's great.
And there's roughly 500 in the entire United States. So that just tells you, the emphasis our health system puts on quality and innovation, and certainly speaks for itself. We go to courses. We're presenting in the fall for our state for PT, and most people just kind of take a step back and go, wow, y'all really doing some great things over there, and just keep it up. So it's certainly validation. But yes, it's a high certification again.
Great. Well, is there anything else you want to add about musculoskeletal ultrasound or the Man Up event before we wrap up, Jay?
I would. I definitely don't want to go unnoticed. Our Gastro Group and Endo Center, our local community provider, is our title sponsor for this event. When we brought it to that group initially to take this on, they were really excited. They're like, man, we've been needing something like this. They saw the same thing. It's like, we need to get out there and educate. And so they're going to be our title sponsor for the next 3 years.
Great.
Which is going to be great. You know, we want to keep this going, keep
That's
driving that message, keep getting those guys to come out and you know, take charge of your health. So really excited for that group and really excited for things to come.
Okay, awesome. Well, thank you so much, Jay, for being with us. And thank you for watching. Stay with us, because when we do come back, we are going to have a member of our presenting sponsors group, Dr. Bruce, to come in here and talk to us about some things that they'll be presenting at our Man Up event. So we will be right back.